Okay, I'm going to start by verifying my hospital policy and order. Then I'm going to do hand hygiene. I'm going to identify the patient using two identifiers, Jaguar J. Jones, 82563, 82563. I'm going to explain this procedure to the patient. Today I'm going to be doing an NG tube placement and an enema. I'm going to assess for allergies on the chart and at the bedside, penicillin. I'm going to provide as much patient privacy as possible. I'm going to gather up all of my equipment. I'm going to don my goggles. I'm going to perform hand hygiene again. I'm going to raise the bed to a comfortable working height, lower a side rail. I'm going to assess vital signs of O2 and bowel sounds. If there's deterioration in vital signs or O2 then I'm going to stop and start the procedure once the stability has been determined. Then I'm going to raise the bed to high Fowler's unless contraindicated. Then I'm going to determine a queuing sign with my patient. Then I'm going to open up my Salem sump. I'm going to take my water-soluble lubricant and put a dollop on it onto my packaging. Then I'm going to prepare all of my tape. I'm going to prepare a piece of tape to mark my measured marking on my NG tube by dog-earing two sides. I'm going to measure the tape. I'm going to take a piece of tape for temporarily securing it to the cheek. A piece of tape for the time that's going to go on their nose after I place it. And then lastly, a piece of tape for permanently securing it to the bridge of the nose. Alright, now that I got that done, now I'm going to loosen the plunger of my 60 milliliter syringe. Okay, now I'm going to apply clean gloves. I'm going to check for a patent air by having the patient hold each nostril and breathe out. Once the patent air has been selected, I'm going to have them, then I'm going to wash the bridge of the nose with soap and water and then pat dry. Now I'm going to measure my Salem sump. I provided a second video showing how I did this. For this patient, it's going to be 35 centimeters. So I'm going to go ahead and attach my tape for marking that. All right, now I'm going to lubricate the first 4 inches of the tubing in my water-soluble lubricant. I'm going to have the patient extend their neck back onto the pillow. I'm going to leave the end of this into this bowl right here. I'm going to insert with the curved side down gently into the patent air. Once I've reached the nasopharynx, I'm going to have the patient flex their head forward, and then I'm going to encourage them to dry swallow. I'm going to insert it 1 to 2 inches at a time, rotating 180 degrees. If the patient coughs or there is a deterioration in vital signs or the patient is in respiratory distress, then I would pull the tube back to the nasopharynx and begin again when normal breathing resumes and after the patient swallows. Okay, once I am at my site marking, I am going to temporarily secure it to the cheek. I'm going to test placement. This fell out of my bowl. I am going to test placement in the nasopharynx using a tongue depressor and a pen light. Now that placement's been verified, I'm going to connect my 60 milliliter syringe to the end of my Salem sump. I'm going to check for placement by aspirating for gastric content. Then I would check for pH, and then I would do a chest x-ray if ordered. All right, now that placement has been verified, I am going to remove my temporary tape. I'm going to remove my temporary tape from the tube and place my permanent tape to the bridge of the nose. And I'm going to note the exit site with an indelible marker for as a guide for any tube displacement. Now I'm going to take my simulated suction. Wait, no. I'm going to clip the tube to the patient's gown, allowing them enough room for them to move their head according to hospital policy. And then that's when I would note the exit site with an indelible marker as a guide for tube displacement. Now I'm going to connect my simulated suction to my Salem sump. I'm going to set it to low wall intermediate suction as ordered. If suction is not in use, I'm going to take the pigtail and cap the Salem sump as such. If suction is in use, I'm going to leave the blue pigtail above the patient's stomach. Now I'm going to lower the bed to a safe height, raise 3 side rails, and then I'm not going to lower the head of the bed lower than 30 degrees. Make sure the call out is in reach, and I am going to position the patient for comfort. Then I'm going to clean up all of my supplies. Remove the draped towel from over the patient, and remove my gloves and perform hand hygiene. I'm going to document the size and type of the NG tube. I'm going to document the size and type of the NG tube, time, location, in the left or right near, how placement was verified, how the suction if used, and the color, amount, and odor of any secretions. For NG tube, for discontinuing the NG tube, I'm going to verify the order. I'm going to explain the procedure to the patient, do hand hygiene, going to apply clean gloves. After I apply clean gloves, I would auscultate for bowel sounds. I would remove the tape from the patient's nose and the clip from the gown. Remove from the patient's nose. I will kink the NG tube, and I will pull it out steadily and slowly. I will discard of this, and I will measure the drainage and do oral hygiene, and document. And that is it for NG tube. Place this out of the way. Now I'm going to move on to enema. Okay, for enema, I am going to gather all of my supplies, perform hand hygiene. Perform hand hygiene, don my goggles, and then don my clean gloves. Come on. All right, now I'm going to take my enema bag, and we are going to go over to the sink to fill it up. I'm going to clamp the tubing. I'm going to make sure the tubing does not go into the sink. I'm going to fill the bag with 750 to 1,000 milliliters of warm water. say that's 750 milliliters. Then I would pour in my soap. I'm going to gently agitate the bag. And now I'm going to prime. Now I'm going to prime the tubing by uncapping it or unclamping it. Once that is primed, I'm going to reclamp it. We're going to head back. Now I would hang this up onto an IV pole or lay it on a firm surface that is not the bed. Okay, now I'm going to raise the bed to a comfortable working height, lower one side rail, and place the patient into left lateral sims. I'm going to take my suction tubing. I'm going to lubricate it while taking my non-dominant hand, placing it firmly on the patient's hip, and encouraging them to take slow, deep breaths during the procedure. I'm going to take my non-dominant hand and spread the buttocks and insert 3 to 4 inches. If the patient has hemorrhoids, they may bear down during insertion to facilitate procedure. Now, while keeping a hold of the enema, I am going to unclamp and hold it 12 to 16 inches above. I can lower the bag or clamp it off if the patient is cramping or feels discomfort. Once the enema is done, I would reclamp it, remove, and encourage the patient to hold it for at least 10 to 15 minutes. Okay, whenever the patient is ready to evacuate, I would assist them onto a bedpan. If I got my bedpan, let's see if we can do this real quick. I would assess the patient on the bedpan like so, the wider side going up under the butt and the more narrow side going up under the thighs. I would assist them on that. After they evacuate, I would document the size and type of enema, how well the patient tolerated it, the color and amount of return, and how the patient was left.